Hey everyone, we're here at our 165 work comp rehab facility. Brent, I'm here with Lauren. We're going to share a little bit about our work comp rehab program and some of the unique aspects that we offer. So Lauren, thanks for joining us. What's unique about this facility? Why is it important to have a standalone, dedicated facility just for the injured workers?
So the reason we have this facility is because we have specialized equipment, and you can kind of see back here, that you won't necessarily find in a typical outpatient setting, that we can utilize to make things as functional as possible for the patient to return back to, and that starts on day one of eval. We start testing them immediately to see what are they able to do and not able to do, so that way we can predict how long it's going to take to get them back to work.
Talk a little bit about that testing. What types of processes do you use? I understand you use AcuPro, which is a standalone EMR system designed just for physical therapists doing return to work. How has that helped you really zero in on that function piece?
The AcuPro system is really nice because we have specific testing we go through, such as a squat lift, a waist shoulder lift, overhead lift, and then we can break it down to more functional aspects that they have in their job. And it spits out a percentage if we put in certain weights that they're able to tolerate based off of what their job demand requires. So this will allow us to better predict the length of therapy that they will require, as well as what percentage of return to work they're at this moment in time. So it's a nice little snapshot of where they're at right now. And then when we reevaluate them later on, it'll take another snapshot and show the line of progress that they've been able to achieve.
So you're applying the same standards, the same tests and evaluations. How often?
So typically in an acute patient, we're doing that every 30 days, or if the follow-up with the physician is sooner than that, we'll do that right before the follow-up with the physician, so that way that you have that information to maybe return them to work sooner. If it's a work conditioning patient that we're actively seeing, we'll be doing that weekly so we can show progress that they're making and hopefully return to work within 4 to 6 weeks.
Great. So Lauren mentioned work conditioning. That's another unique aspect that we offer at 165. Can you take a minute and explain how work conditioning is different than regular rehab and who might be appropriate for it?
So work conditioning is a full body conditioning program. So if you're an injured worker who injured your shoulder and you went through acute shoulder rehab, your whole body has now been out of work for whether it's, a month, 2 months, or a year or more. So we're working on conditioning your entire body to return to work and doing all of the demands that you're required to do to fulfill your job. So we're addressing cardiovascular, stretching, upper and lower body, core strengthening, functional activities you do, body mechanics, as well as any fine motor activities you might be doing in balance. So we're making sure the whole entire worker is ready to return to work successfully versus just that one injured body part.
And how often does somebody do work conditioning?
So work conditioning is a 3.5 to 4 hour program, and it's typically 4 to 6 weeks in length. They come 5 days a week, so that way it's reorienting their whole body back to doing that same amount of work. They're just doing it more frequently now. And so we can also determine whether they're successful to return to work based off of, psychosocial aspects too, and making sure that's ready to return to work. Some people are very fearful, so we can start showing them what they're really capable of and make sure they're successful in that return as well.
I do want to make one point. There's often confusion between an FCE, a functional capacity evaluation, and a work conditioning program. Can you just briefly highlight what an FCE is, when it's appropriate, and when a work conditioning program is appropriate?
So an FCE is a snapshot of what the patient is able to do, and you determine whether that case is completely closed and this is the most they'll be able to do, or if they need more care. A work conditioning evaluation says, we think this patient can do more, we just need to really hone in and really condition the whole body. So the evaluations are very similar, and we're testing all the same things. It's just also introducing them to the work conditioning program and really justifying and conditioning their whole body, and then showing that change in their whole body and what their whole body is able to do to return to work.
Awesome. So if you are working with a work conditioning patient, or let's say a work comp patient, and you feel like work conditioning is appropriate, what should we expect for the physicians if you're seeing one of their patients? How are you going to identify them?
So if I have a patient that is appropriate, I'm going to do an AcuPro note, and in that recommendation section, I'm going to put in there recommend work conditioning within this many weeks, or recommending it now that they start this. And it does say in that note, 3.5+ hours per day, 3 to 5 days a week. If the patient is going back at a modified duty level and their work is only willing to let them come 3 days a week, we can do that. But we most of the time like them to come 5 days a week, because we can really work them at the level required to return to work quicker.
And there's no requirement that a patient has an FCE prior to starting work conditioning?
No, the FCE is more an icing to close off, the whole cake case. So if your patient's not able to get back to work full duty, if your patient is possibly going for disability rating, then that's the icing on the cake to close the case off. Or an FCE is saying, you know what, you are able to do this and get back to work. But even work conditioning, you know, if they hit 100% work conditioning, we can make the recommendation to return back to work and not even need an FCE at the end.
Awesome. Well, thank you so much. I learned a lot. Doctors, we miss you. We wish you were actually here with us right now. But in this COVID time frame, we feel like this is the best substitute we can offer. Hopefully, one day we'll be able to bring you down here and actually show you a sample evaluation, show you some of the tools that we use here to get these injured workers back to work quickly and safely. And Lauren and her team can take you through a workout together. So thank you very much, and we'll take questions.
Thank you.